Good afternoon. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, here to give a data update for the City of Chicago's COVID-19 numbers. First, our travel order. Chicago's travel order now consists of 31 states and Puerto Rico. Florida is being added, and Michigan is likely to be added next week. Just as we've done for other neighboring states where we know there's a lot of travel, we've added Michigan to the warning list. If we do not see that number come back down under 15 cases per 100,000 per day, Michigan will go on the list next week. As always, the implementation goes into place on Friday. We've seen some improvement in 2 states in the last week. That's West Virginia and Delaware. If they have another week where they're below the 15 cases per 100,000 per day cutoff, they will come off the list. Nationwide, as you can see here, we are not doing well from a COVID perspective. I'll remind you that the states in red are simply a cutoff. They're places where we're seeing more than 15 cases per day per 100,000, which is equivalent approximately to 100 cases per week per 100,000, which is generally recognized to be an area that is high risk for COVID. The states that are in yellow are between 10 and 15 cases per 100,000, meaning getting near the level of high concern. You can see there's just a handful of states in the far northeast, the far northwest, and Hawaii that are below 10 cases per 100,000 per day. But 45 out of 50 states saw an increase in COVID cases this week. Nationwide, cases are up about 26%. And our national 7-day rolling case count has passed 500,000, meaning this is the worst we are doing on COVID as a country since the beginning. Also true in Illinois, as a state as a whole, we are doing the worst that we've been doing in terms of case count as a state since the beginning of COVID. So as you're thinking ahead, perhaps to Thanksgiving, please keep this map in mind. Traveling is a concern right now. When we are coming from Chicago or from Illinois and traveling out, we are bringing a potential risk of COVID. When people are coming to Chicago from most of the country at this point, they're bringing an elevated risk of COVID. I am not planning to travel this Thanksgiving unless we see significant improvements in this map. And I would encourage you, especially if you normally are getting together with people who are older or have underlying health conditions, to think seriously about whether this is the year for travel. We're particularly concerned where we think about college students, for example, who may travel a lot around Thanksgiving, and the potential for seeing even more surge. My hope is that a month from now we'll be in a better place. But that's not the way the numbers are heading now, and I want to be honest with you about what that risk is looking like. Here's what our Chicago numbers look like. As always, you can go to chi.gov/COVID- or chicago.gov/coronavirus to learn all about the Chicago numbers for COVID. We are now at an average number of 798 cases just in Chicago every day. I'll remind you, 400 was our level of concern. 200 was the level that we wanted to stay under, and we were under 200 for just a little while early this summer. It's heading the wrong way. Secondly, test positivity citywide in Chicago, per the Illinois Department of Public Health website today, is at 7.8%. Remember, we want to be under 5%, and we were just a few weeks ago. We've been seeing a dramatic increase in this percentage day after day after day. If you go to the city site, you'll see this number's a little bit lower because it takes time to actually get the data from the state. And the way we report is on the date that cases are diagnosed as opposed to when we're getting case reports back. Where you're seeing some difference there, it's because it's how fast our cases and our positivity are increasing. Let's put this in some context in terms of our own reopening metrics. As we announced on Thursday last week, that we are now in the stop phase, and we did need to pull back here as a city in terms of closing the indoor bars, putting that curfew for the non-essential businesses in place, not allowing alcohol sales after 9 p.m. And we've been following this closely. We've not seen improvements in cases, hospitalization, deaths, or emergency department visits. We're clearly still in that stop range for our reopening metrics. You'll see our test positivity rate is just under that 8% mark, but I expect it to be there imminently. And finally, on the hospital system capacity at the bottom, we've moved from advanced progress to continued progress, meaning the wrong way, not just for our non-ICU beds, but now for our ICU beds as well. And I'll show you some details around that. So first, here is the graph overall of our Chicago numbers. Remember, I told you at the state level, the outbreak is now exceeding what the peak was in that first wave. Here in Chicago, we're not quite there yet, but look where we're going. The rate of increase that we're seeing is still the same as what we were seeing in the first wave between March 19 and 31. It's not shown significant signs of slowing, and we are now at a doubling time of 9 days. What that means is every 9 days, our number of diagnosed cases is doubling. So if we're at 800 cases today, and we continue on this trajectory, in 9 days, we would be at 1,600 cases on average, well exceeding our first surge. Let's also put this in the context of all of the cases that have been diagnosed in Chicago. As of now, we're at 94,344 Chicagoans who have been diagnosed with COVID. If we break out what has happened to those folks, 8,213, or 9% of them, are active cases right now, meaning they are infectious, they've been tested. This number is going up because we are seeing so many more cases being diagnosed right now. 83,000 plus of these people, 88%, have recovered from COVID, and we've had 3,037, or 3% of our cases, have died. But if we take the 8,213 active cases, remember, between 5 and 7 times as many cases as are tested and diagnosed actually have COVID. Nationwide, this estimate is between 5 and 10 times. We think here, based on our data, it's in the 5 to 7 times range. And that means that right now in Chicago, between 41,000 and 57,000 Chicagoans have active infectious COVID. This is spreading, and this is why we recommended last week and continue to recommend that you not invite anyone into your home that does not live there, unless it is for an essential purpose, like home health care, essential child care, or education. If people are coming into the home who do not live there, people should be wearing masks and social distancing. But the strong recommendation is to do everything we can to stop the spread, especially when we're gathering with friends and family, which is still the main way that our spread is being driven in Chicago. One other way of looking at these numbers is that 1 in 250 Chicagoans have been infected and diagnosed with COVID just within the last 3 weeks, which again, where we think about the folks who are not diagnosed, 1 in 50 Chicagoans has been infected within the last 3 weeks. And if we look at our graphs, these look similar to what we looked at last week, but I want to emphasize that we are seeing COVID cases dramatically increasing across all race ethnicity groups. On the graph here, the blue represents Latinx Chicagoans who are still disproportionately impacted by cases. But I want to point out that for the first time this week, among white non-Latinx Chicagoans, we are seeing rates of COVID that exceed what we saw in the first wave. I expect if this does not turn around over the next few weeks, we will similarly break those records for Asian, Latinx, and Black Chicagoans. Also a severe warning, our Chicago cases have continued to dramatically increase across all age groups, including among older Chicagoans. But I want to point out something different just from last week, is that right now in Chicago, COVID rates in age 30 to 39 and 40 to 49 are the same as the highest rates that we've seen among our 18 to 29-year-olds. And so we've been talking a lot about how our youngest Chicagoans have been driving a lot of COVID, and that remains true. But right now, we're seeing as many people in their 30s and as many people in their 40s being diagnosed with COVID. And more concerning, down at the bottom of this graph, the gray and the pink represent our folks who are over 70 and over 80. We've seen those rates also more than double just over the last few weeks. These, of course, are the people most likely to have the severe outcomes, get hospitalized, or even die from COVID. If we look at our diagnosed cases by race and ethnicity and age, last week in Chicago, what you see here, again, blue represents Latinx Chicagoans, red is white Chicagoans, purple is Black Chicagoans, and green is Asian Chicagoans. You see that as people are getting older, we're not seeing as much of that race ethnicity separation. Everyone needs to play their part in terms of keeping the risk of COVID down, wearing your mask, socially distancing, washing your hands, and especially protecting folks who are in the highest risk for severe outcomes. Here's what our test positivity looks like by zip code for the week just ending last Saturday. Remember, across the whole city, we're pushing 8% positivity, but you can see that in the darkest blue areas, that test positivity is between 13% and almost 20%, and it goes down from there. We are seeing cases increase in all parts of the city, and we are seeing spread across all age groups in all parts of the city. Here's what our hospitalization data looks like. So these are the numbers that are reported in daily from all of the hospitals in Chicago. These are not necessarily Chicago residents. These are people who are in any of our hospitals, whether they are in a non-ICU bed, an ICU bed, on a ventilator, with COVID-19. We include both people diagnosed with COVID-19 and those who the doctors suspect have COVID-19, but we're waiting on a test result. And what we can see for our non-ICU hospital bed capacity is that we had our low point at 249 people in the hospital, but not in the ICU, with COVID or suspected COVID back on September 22nd. That's been increasing. And as of now, we're at an average of 428 people in the hospital, and we've had an individual day topping 450. If we move to our ICU occupancy, this again is where we've started to see some changes. So our ICU occupancy, you can see, was 77 is a rolling average, October 1st. And we've gone up to now an average of 120 people in the ICU with COVID in Chicago, a 56% increase, and tripped over our advanced progress threshold. Our ventilator use is still stable at this point, as are our deaths. And I want people to understand that unfortunately, this is the way that we see this happen. First, we see our cases increase. Then, as more of those people spread it to others, as we have people, especially with underlying conditions and those who are older, but also just more cases, it typically takes a couple of weeks to see the hospitalization numbers really start to tick up. Then, unfortunately, it can often take another week for people who are in the hospital but worsening to need to get moved to the ICU and then to the ventilator. And then, unfortunately, we do see people die. So you'll see, although our average remains at 40, we most recently actually have gone up to 56 people reported on ventilators. It's also heading the wrong way. We've been answering a lot of questions about what do we know about how folks are getting COVID here in Chicago, and I know that's a question you have too. So I wanted to highlight first that we follow very closely where people are dying from COVID, whether that is associated to a known outbreak, meaning a location that has had multiple cases with spread at that location. And what you can see is that in our first surge back in April and May, in red, many of the cases were associated with a known outbreak. That was led by long-term care facilities or nursing homes, but it also included other congregate settings where people are living together. We looked at, for example, people who were sharing space. We saw more larger outbreaks among workplaces, some larger factories, et cetera. We have broadly gotten that under control as a city. Our percent positivity in these congregate settings has been below 1%. But we are starting to see some real increases there, including in our most vulnerable settings, like, again, our nursing homes. The health department is working very hard. There is repeat testing happening at least once a week in those settings. But again, risk is increasing simply because there's more in the community. You can see over the summer and even up until now, most of the people, even who are dying, are not associated with a known outbreak. These are people who are unfortunately getting sick from being in touch, for the most part, with people that they know. A lot of this remains in the household, in small gatherings. I think a lot of people are still imagining that we're seeing huge outbreaks with hundreds of people. Broadly, many of our outbreaks are in the range of 2 cases, 3 cases, 6 cases. I also want to highlight a report that is coming out today from the CDC that has a focus on Chicago. So the Chicago Department of Public Health, in conjunction with others, and the CDC, did report an outbreak among a university men's and women's soccer team. And there were 17 cases. So this is an example, again, of this would be, at this point, a fairly large outbreak in Chicago. 17 cases among the men's and women's university soccer teams. And when the team went in and did an investigation with these soccer teams, talked to people who had COVID, talked to people who didn't have COVID, worked to understand risk factors, actually heard about 19 different social gatherings just in a very short time period. A birthday party, a co-ed soccer match, people getting together. Not unexpected. People living their lives, particularly college students. A lot of this is about being social. And these events were being attended by people who were asymptomatic, meaning they didn't have symptoms, they were pre-symptomatic, or they were mildly symptomatic. We didn't have people getting seriously ill or needing hospitalization, but they were reporting minimal mask use and not a lot of social distancing at these events. And so the recommendations are around the basics, increasing mask use and social distancing, and then periodic repeat testing among groups. I'll show you just to give you a sense of the timeline here, because I think it helps make it a little bit concrete. These soccer teams, this was back in July, came back in, started their training sessions, and then about 9 days after the training sessions began, there was a large birthday party that we think may have been potentially some source of spread. In the dark blue are the men's soccer team, and the light blue are the women's soccer team. And there was a co-ed soccer match, and then the first soccer player is only reporting symptoms after that co-ed soccer match. Absolutely, the university did all the right things here. Isolated the player, instructed eventually both soccer teams to quarantine, even with just that one case. But you can see that all the rest of those cases came after that. These were people who were already infected before anybody ever had any symptoms. And so you can see that, again, over the next, and this is how these outbreaks work, you'll see them come not all at once, but over a number of days. And the players were in quarantine. You can see all the way on the right is when they were finally released from quarantine, again, began weekly testing and were able to resolve. So I just wanted to point it out because it's an example of just the basics of how people are interacting, and that just trying to rely on symptoms is not the best approach to protecting you or those you love against COVID. You need to wear the mask, you need to social distance. And what are we seeing now leading to outbreaks under investigation? I had the team just do a quick readout for me. We've been really busy at the health department, of course, with this surge in cases. We're doing everything we can to do case investigations, outbreak investigations, reach out to the contact tracing. But it's also a big pressure on us from a response standpoint. So we're doing everything we can, and again, asking you all to do the things you can in terms of helping us with these investigations. We are just hearing, as I said, about so many small social gatherings with spread. We're investigating right now a wedding that was at a restaurant, an event venue, with 18 cases across multiple jurisdictions. We're investigating a Halloween party at a daycare, which was held outside but unmasked. 5 students, 2 staff, 1 parent to date, still underway. We're investigating a women's conference at a church. Multiple cases. Investigation is just getting started. We're investigating outbreaks in the double digits, more than 10 cases at 2 skilled nursing facilities, 2 shelters, an assisted living facility, a convent and retirement home. Again, recognizing that these are particularly vulnerable settings. And if you are going into those settings or you're living in those settings, it's especially important that you're doing everything you can to limit risk. We're also seeing more individual cases at schools. People are getting infected in the community, coming into school communities. Clusters of friends outside of schools. More individual community-acquired cases on intake to the correctional facilities. When people come into the jail, for example, before they move into the general population, they're held for 14 days to make sure that if they're coming in with COVID, there isn't spread. And we're seeing increased cases in that setting, not surprisingly, given what's happening in Chicago. We're seeing more cases in hospital and health staff, and we're seeing more individual work-associated cases and outbreaks. So I imagine all of you are hearing a lot more about COVID right now in your regular lives. That's not by accident. There is a lot more COVID around. We are doing an investigation in a food service company that's got 8 cases, a metal manufacturing company that's got 12 confirmed and 5 suspect cases. My point is that COVID is widespread here in Chicago, and we need you to double down on the things that you know work. Please, as much as you can, if there are interactions you're having that are not essential, back off on those. That is the end of my update, and I am happy to take questions.
Okay, this is from NBC5. We've seen some restaurants and establishments using igloos, bubbles, or other enclosed structures for outdoor dining in colder months. Are these safe?
Yeah, so the number of times a day I get asked if something is safe for COVID is infinite. There is no such thing as safe or not safe from COVID. Any interaction with a living, breathing human being carries some amount of risk of COVID. However, in these particular situations, we've spent actually a lot of time trying to think about how to support our restaurants through the Chicago winter. People will have seen that just yesterday in suburban Cook County, the governor did announce that indoor restaurants needed to close. And the way that our data is going here, I suspect that we may not be far behind. And I am very worried about what that is going to mean for the financial health of our restaurants, frankly, and all of the people who work at them. And so I appreciate the creativity and the work that many have been doing into thinking about how can we, in a relatively safe way, open up outdoor dining possibilities. So yes, the designs that are being submitted around these igloos, the outdoor dining challenge, the ways that restaurants are working to enclose space are absolutely being looked at from a COVID perspective related to ventilation. They're also being looked at from a fire perspective. These are being heated, so we need to make sure that the fire department is evaluating plans. The business affairs department, we're looking at entries and exits. We want these spaces to be as safe as they can be, and we want to really be able to support businesses doing creative things. The last thing I would just say on that is this is going to be a difficult winter for everybody. And I think the more that we can be serious about COVID and think about also how we can support each other and support small businesses through this winter is going to be crucial. And so I would really ask people who have the means to be thinking about how can I, for example, move to supporting restaurants, perhaps by eating in an igloo outside or by getting carry out or takeout. So if people are interested, maybe on one of my Facebook Lives, we could talk in some more detail about what those outdoor dining requirements are. But I have every confidence that the structures that are being put up are COVID appropriate and generally good for use.
Okay. This is from Block Club. Deaths have fallen as doctors learned more effective treatments for COVID-19, and people have become less afraid. What are doctors doing differently that has helped bring down deaths? And follow up to that, what would you say to residents, especially younger ones who aren't as afraid and aren't being safe now?
Yeah. So a couple things on that. One is that we have not yet seen a surge of deaths in Chicago, and I am very, of course, pleased to be able to say that. But unfortunately, I do expect that we're going to see some increases in deaths. My hope is that this will not be a repeat at the same level of what we were seeing in that first surge. Some of this is because of the different demographics of who is getting most infected, but we have learned a lot about how to care for patients within, particularly the hospital setting, those who are getting sickest. Just to give you, and I want to be very clear, there is not a cure for COVID. There are still people who think there is a cure. There is not a cure for COVID. There are some medications that have been proven to have some help, especially for people who are critically ill. But we've also learned things about what is the best timing to put somebody on a ventilator. How do we position people or sort of use oxygen levels? Sort of some best practices have developed. And frankly, doctors have had a lot of experience at this point in terms of taking care of critically ill COVID patients. And when you have a lot of experience in terms of taking care of a particular disease, you learn what makes the most sense in terms of when to take different medications on and off, what kinds of protocols to put in place. So unfortunately, that is experience that we've gained here in Chicago and across the U.S., but we are absolutely seeing cases surge across Illinois. You probably saw that we've hit the highest rate since that first surge early on, and I do not want people thinking that people are not going to die from this surge of COVID. Even if we're averaging 3 deaths per day right now, which is what we are in Chicago, that's more than 1,000 people a year, and unfortunately, it's much higher than that. So even for younger people, we do see still young people getting seriously ill from COVID. We see people having long-standing effects from COVID that we're still learning about. We do see, not very commonly, but we see young people hospitalized and occasionally even die from COVID. But what we also see clearly is young people spreading it to folks with underlying conditions and those who are older. And so I would ask young people, but not just young people, I showed you data today, our 18 to 29-year-olds, 30 to 39-year-olds, and 40 to 49-year-olds are all at the same point right now in terms of leading the curve for outbreaks. And I know there are a lot of folks in those age groups who potentially are carrying underlying conditions and are exposed to those who are. So we've made progress, but we're a long way from having a cure, and we're still, unfortunately, I think many months from having vaccine available.
This also from Block Club. Chicago police officers were told in an email they should keep working but wear masks, even if they think they've been exposed to COVID-19. Doesn't this go against the city's advice for other city workers and residents? And does it put people who interact with officers at risk?
So, as you heard last week, there was a lot of focus on really doubling down on particularly the mask wearing portion here for all city employees, but led by our public safety teams, who of course are at a particularly high risk for COVID exposure given the high amount of public interaction that they have. And what I can say is that there are some essential sort of critical infrastructure workers that have been defined at the federal level, where there are sometimes exceptions that will be made around what an exposure looks like versus sort of what is a mask required. So my main message is that police officers, firefighters, streets and sanitation workers, Chicago Department of Public Health employees, every city employee is absolutely expected to be wearing a mask. anytime that they're interfacing with the public, anytime where they're not keeping that 6-foot distance, we've really doubled down again on those protocols at the health department, and I know that our sister departments and agencies are doing that as well.
Great. This is from Telemundo. We are seeing an increase in cases all throughout the city, but particularly in zip codes like 60629 and 60632, Gage Park and Brighton Park, where there's a high concentration of the Hispanic population. Is there a particular reason why we were seeing an uptake in these spots, and what is the message you want that particular population to keep in mind?
Yeah. So, as we've been talking about really week after week, we have disproportionately seen cases, particularly among Latino or Hispanic Chicagoans, and particularly on the southwest side. And that map that I showed, you saw that's where a lot of our highest test positivity is. Certainly, we've been working to push resources hard to that area, whether that's testing resources, both the static sites and the mobile sites, outreach, working with partners. I really want to thank the many people who have been stepping up in all kinds of ways to try to get on top of this. But what I can say, we have shared previously some of this geographic breakdown by risk. And when I think back, I think 2 weeks ago, we showed some data comparing where we're doing case investigations and talking to people in different parts of the city. We ask, do you know someone who had COVID? Do you have a sense of how you may have been infected? And particularly in the Southwest, which has been our major area of concern recently, that was the area of the city most likely to report that, yes, in fact, they did have a sense of who they may have been exposed to. And most of the time, more than 2/3 of the time, it actually was a family member. That was really different than what we saw. There was a cluster on the north side, the near north side. And in that setting, people were less likely. In fact, it was like 12% said that their contact had been with a family member. It was younger people there, older people there. There's a lot of differences. But what I would say is that if not just in those zip codes, but any of the zip codes that we're showing that are high positivity, those are the places where risk is higher. Those are places where we have more essential workers broadly who are less able to work from home, people who are out and about, unfortunately bringing it back to home, but we still continue to see a lot of spread within the home setting. This is just a fact. And as I spoke about this morning on Facebook, as much as people are able to, if you yourself, no matter where you live in the city, if you've been diagnosed with COVID or you've been exposed to someone with COVID and you're quarantining, the more you can do to try to separate yourself from others in your household, the better. It is not a given that there is spread within the household. 2/3 of the time, we don't even see spread within the household. But if you can, and we know this is not possible for everybody, where there's crowded housing, et cetera, but if you are able to, try to have the person who is sick sleep in a separate room from the other people. If it is possible, and we know it is not always possible, try to have the person who is infected use a different bathroom. Double down on wearing the masks, even inside the home. Extra cleaning, hand washing, don't do the food preparation together. I know it sounds hard, and it is hard, but one of the most important things to do in areas where we are seeing this surge, and we know that people need to leave their home for essential work, is to be as careful as they can if they know they've had a COVID exposure, or especially if they're sick. Number one rule still, you must stay home if you are sick.
We got a question on testing from the People's Tribune. Given the increased COVID infection numbers, will the city increase its consistent? Well, it starts off, there are only 3 testing sites now. Given the increased COVID infection numbers, will the city increase its consistent testing sites? And will the city widely advertise the mobile testing sites within a reasonable lead time?
Okay, so a couple things on that, probably of clarification first, and then to talk in some detail. So, every single week, the Chicago Department of Public Health looks at our data for that week, like that map that I showed, and we say, which are the zip codes where we are seeing surging positivity or surging cases? Separately from the community-based testing, we do a lot of testing in outbreak-type settings, in long-term cares, in these higher-risk settings. But in the community setting, where we're seeing these surges, that's where we've worked to push testing resources. And we don't just have 3 sites. Every week, I think she's probably referencing the 3 static sites that are there routinely. But we do push these mobile sites out, specifically working with the Race Equity Rapid Response Team every single week to get them to exactly the area where we're wanting people to most get tested. All of these are available, chicagocovidtesting.com. You can go, you can see them, you can sign up in advance. But I will tell you, with the surge that we are seeing in cases, it is going to be harder and harder to be finding a test. And I cannot say strongly enough that the number one place we want you to be getting tested for COVID is with your healthcare provider. If you are sick, particularly if you have an underlying condition, we want you connected to a healthcare provider. The goal where the city is pushing testing is really to push some additional resources to areas where we're seeing that increase. We also, actually just yesterday, for the very first time, Chicago Department of Public Health received some rapid antigen tests. And not to get into too much details, but these are the new tests that you can do without a laboratory. They can be done on the spot in about 15 minutes. They're not quite as accurate, meaning sensitive or specific, as the traditional PCR that need a lab. Instead of being like 97%-ish accurate, they're more like 90 to 92% accurate, depending the use. But they have real potential because the turnaround time can be fast. So what do you think we did with those? The first place they are going is our federally qualified health centers. Those are the settings, again, that you can get medical care regardless of insurance, regardless of your immigration status, regardless of whether you have a doctor. They are set up to care for you. There is a sliding scale for payment that goes all the way down to 0. And I would most like people to make sure that they are getting connected to medical care. So that should be your first check, is with your provider. The city, of course, is going to continue to push testing sites, but it's getting cold there too. So we're doing a lot of work to think about what winterizing testing sites look like. We're looking at vans, we're looking at smaller trailers. We'll probably do an announcement either later in the week or next week to share some more of what that is going to look like. But as a reminder, the health department does not traditionally do any testing. We don't have a laboratory here in Chicago. What we're trying to do is push testing capacity into clinical settings and then supplement it in some of the areas of the city where tests are most needed.
Okay, I've got a couple questions related to Chicago triggering additional mitigations per the Illinois Department of Public Health. As we saw in the news, suburban Cook County, there was an announcement surrounding that and renewed restrictions from the state. And apparently there is a report that may happen as soon as today. Are you concerned about the state instituting new restrictions? And what mitigation efforts do you think are most appropriate in light of the rising both test positivity rate and hospital admissions? Yeah,
so what I can say to that is obviously I'm concerned. We're at a 7.8% positivity right now per the Illinois Department of Public Health website, but that has absolutely been increasing day over day over day over day, as you've been hearing us say. We are also seeing increases in hospitalizations, as I've pointed out. There's a lot of different ways that you can measure hospitalizations. You can measure hospitalizations by people who are diagnosed. You can measure people like we showed across all Chicago hospitals, regardless of whether they're Chicago residents. You can even measure for people while you're still waiting on a COVID test result. What I can say is that I would be surprised if we did not see mitigation coming and coming soon. I've not spoken to Dr. Ezike about it today, but the numbers that we have seen here give me no reason to think that this is not imminent. So I think we'll see what comes there. My expectation would be similar to what we've seen across half of the state, is that these would be the tier 1 mitigation strategies, which most notably would include the closing of indoor restaurants. If the governor makes this decision, we will obviously support it. One of the reasons I mentioned that I would really like to ask Chicagoans if they are able to think about how they can support our restaurants at this time is because I think it's possible that this may happen, and it may happen soon.
All right, that's it. Thank you.
Can we get some of the slides, like the nature